Good evening, everyone. It's nice to have you here. And Brian, thank you for having me. My name is Gbolahan Yusuf, and I wear quite a number of hats, and that is going to reflect in my presentation today. Now, today we're talking about shaping the future of health in Africa through technology and humanity. Now, when I thought of presenting this topic, I actually looked at it from different angles. Like I said, so I'm a medical doctor. I have my practices in Lagos. I'm also a business coach and mentor. So I'm going to be looking at it from a medical or a healthcare personnel who currently is involved in the healthcare space in Nigeria, a country in Africa. I'm also going to look at like a business owner and the challenges that come with creating value in the healthcare space. And then lastly, as a business coach and mentor who helps businesses to try to scale their business, help them solve problems and all present problems and future problems. So that means that I'm going to be looking at the present state of our healthcare and also how we can get to the future that I personally have imagined for Africa. Now, the future, as you all know, like I like to tell a lot of people that I mentor, is not something you wait for. It is something we shape. Where you are now, if I'm going to use you as an example, you're a combination or the product of decisions you've made or decision made or not made in the past. And also, of course, a conglomeration of other environmental factors and the likes. Now, and so I'd say that where we are today in Africa is because of decisions that have been made in the past. Where we are today is because of the situation, our environmental factors, the political, the government will of our leaders, and then the behavioral factors of even everybody involved in the healthcare space. So where we are today, and we're going to look at that briefly. But the future we intend to, where we want to get to, is something we can begin to start to shape. And there's no better time than now to do that because now we are armed with a lot of tools that has created like a level playing field whereby the young man in Burundi or in Kigali or in Kenya or Addis Ababa can actually desire a product or desire a particular problem to solve and is armed with the tools to solve them. The future of medicine lies not in machines replacing doctors, but in technology amplifying humanity. One of the conversations we've had in the last year and even this year with the adoption of artificial intelligence worldwide is that people have said that okay, we have robots that can do surgeries, we have doctor robots that can make diagnosis, robots or AI itself can make diagnosis, can prescribe drugs and all. And then there's that fear that is it possible that a time would come whereby we no longer need doctors. Now, the threat to replacing humans in medicine is not different from what you have in other spheres of life. You know, right now, people, in fact, if you have a birthday, the days of probably paying a photographer to do a photo shoot and then you have your pictures out there, you find out that a lot of people, rather than spend all of that money, are going to AI using Gemini to generate the images and you have them posted on their birthdays, wedding anniversary, and the likes. But and then there's that fear that what's going to happen. That's one. If you look at the music scene, you have AI platforms that you can go and say, create a beat the way Fela Nicola Kokuti would have created that beat, and it's going to give you a beautiful Afro beat. And I'm sure you've watched videos of these things. And then the question is this: is AI not going to come to replace doctors, artists, and in every sphere or sector of life? But one thing I'm here to say, and one of the things I'm going to be talking about today, is the fact that AI technology is not coming to replace doctors or healthcare personnel, but it's coming to amplify them. How is this going to happen? I'm going to just follow me as we go on in this discussion, and then I explain a bit more. Now, I personally believe that Africa is at a turning point, and because our healthcare challenges are real, but as real as they are, so also are the opportunities. Now, it's said that nobody is the man or the lady that wears the shoe that knows where it pinches. And because of the enormity of the challenges that face us, we are current, and they have seen that done to a very high level in the financial space. We're currently innovating. We're currently looking at ways with which we can use technology to solve our problems. So, and what I believe in healthcare is that we are not going to try to, and that's happening. I'll give you examples. We're not trying to improve on what we currently have. We are actually creating new solutions. And I'll tell you for as many people on this call for free that if we continue on this trajectory and apply some of the things that we're also going to talk about, Africa is really going to leapfrog the Western world when it comes to healthcare. And one of the things we're going to be applying, the winning formula is actually technology and humanity. There's a quote here I'd like to actually, that I put here for you to actually read, and that's the future is not something we enter, the future is something we create, by Leonard Swift. What's our current healthcare reality? We all know that this is the fact. That so is, I'll just run through them. The shortage of healthcare personnel. Now, the population of Africa was about 283 million, thereabouts, 1960. And 65 years later, 2025, we are about 1.8 billion. And based on the 2.5% growth rate, it is projected that by 2050, we're going to be 2.5 billion. Now, that is the population of people that also care. You know that everybody requires one form of care concerning their health or the other. Now, this rate of growth is faster than the rate at which healthcare personnel are being educated and then they graduate from their medical institutions. Now, I'm going to use, as much as in this, I'm going to be comparing doctors and the population, just using doctors as a unit of the healthcare personnel and then using it to compare to the population. And right now, it is said, and it varies from country to country, you have one doctor to about 5,000, in some places up to about 10,000 members of the community. Now, you know that that is humanly possible. A doctor can, even if these doctors are evenly distributed within the country, you know that it's not humanly possible for one doctor to cater to 5,000 people. So we have a serious shortage of healthcare personnel ratio the population. Apart from that, what even makes it more dire is the fact that we have an unhealthy urban-rural distribution of our facilities and also of doctors. Now, for as many doctors on this call and as many people that are here that have had to go through the National Youth Service Corps, during your NYC year, we're posted to different parts in Nigeria. We're posted to different parts of the country. Now, some people get to go to areas where there are rural areas with little or no amenities. Now, they have poor supply of pipe-borne water or electricity, even for hospitals, schools, and the likes. Now, there's a shortage generally, but then the uneven distribution of facilities and doctors also widens this health gap. We have delays in diagnosis and treatment. Now, delays in diagnosis, we'll learn this in medical school. There are three levels of delays. And one of the first level is even the decision of the patient, the patient or the member of the population in deciding that they want to go to the hospital. And you know that happens. It happens in my practice. Sometimes some people show up 24 hours later than when they were supposed to present from the onset of the symptom. And then you're asking questions. And sometimes the health-seeking behavior is poor. Sometimes because of the financial implication of showing up in the hospital, they need to wait for someone or they need to make calls to, and then because of our family structure, where our families are closely knit, there's also a head of family who probably will give go ahead and all. That's one. The next delay you also experience is the delay from having decided that I want to get to go to the hospital, and then the time it takes from that time to even transportation to the hospital. Sometimes the hospitals are in remote locations, or just one hospital is serving an entire local government, and then it takes a long time for them to travel during the. And once they get there, there's also delay in seeing doctor. Imagine a doctor is on seat and you walk into a hospital, even though it's you want to see the doctor urgently, and then you still have like about 20, 30 people waiting to see the doctor. So that delay in diagnosis before they see the doctor, make a diagnosis and treatment is one of the issues we have currently. And then the high out of pocket cost. Now we don't have a lot of health insurance, widely adopted health insurance in the African countries at the moment. And that means that a good number of people will have to pay out of their pockets. And then the cost of healthcare is actually very expensive. Now, in spite of what I've talked about in terms of this reality, in spite of this reality, we still have strengths and opportunities. One of the things is the fact that the average African is very resilient. Now, by virtue of the fact that what we go through growing up and the challenges you had to find a way around, I think we grew up with that mindset that we need to know help is coming from nowhere. You have to figure it out yourself. So most Africans actually develop with that innovative mindset, such that when they get the right education and the right tools, they're able to create out of nothing solutions that would be adopted and then, of course, will be beneficial to a lot of people, our youthful population. 2020, 21, 22, 23, I think it's still going on. The Western world opened up to a lot of Africa. And one of the major reasons is because they are when they look at their demography, there's a wide gap between, because they already start having an aging population, while the youths, the percentage of the youths is actually thinning out. And that's one of the reasons I believe, and I think that is true, why their doors opened up to our youth. Now we have a youthful population, and the youthful population is the productive population or the productive age group of any nation. Now, because we have that, that is also a strength. And we've started, and one of the things I'm trying to highlight, and at the end of this conversation, is how a lot of us can actually adopt solving the healthcare problems of our nation and of our continent, and then leveraging on our population and our innovative spirit and the resilience that we have in shaping the future that we desire. And then, of course, digital health and regional collaboration. Now, a beautiful story, I think, is in Kenya, M-Pesa, I'm not sure how it's pronounced. They had issues with in their financial sectors a few years ago, banking and all. The banks are not well, they don't have enough banks for people to access funds, transfer funds, make payments and all. And then some guys just came together and looked at that. See, a lot of people have mobile phones. And if they can actually come up with digital banks, or digital financial institution whereby they can make transactions, get access to funds, pay in their money and all. And in fact, it was a big hit. This year, I've been to a few West and Eastern African countries. And I realized, unlike in Nigeria, where Momo is not really a thing there, in those places, Momo is a big thing. And I looked at, and when I go there, it's before I see a bank, sometimes you have to travel a few kilometers. And I began to say that, okay, possibly at the time, even before I read about the story of M-Pesa in Kenya, I realized that the adoption is higher there compared to maybe Nigeria, because we have a lot of banks and the banks are everywhere. Even in remote areas, you still see them. But now, what we have done in a financial institution by looking at mobile phones, also digital health, we can also leverage on that and also adopt that in healthcare. That has started, but we need to do a lot more. Now, when I consult for businesses, when I talk to business owners, one of the things I look out for is how have they married their business processes and how they have used technology to make them run seamlessly. and then to help them with um, maintaining them, analyzing, looking at monitoring, and then evaluating. Because one of the things I tell business owners, and one of the things I'm going to say here, and I've seen that happen, is that technology would help us scale at a very fast rate. Technology is what helps to bridge the gaps. And the crux of my message today is how technology can cause us to leapfrog even the healthcare, excuse me, the healthcare structures, leapfrog the healthcare systems of the Western world, and then deliver the kind of healthcare that is tailored and suited for Africa, that solves identifies our challenges, our limitations, and solves our problem. Technology helps to scale care. Artificial intelligence supports better decisions. Now, the thing is, I'll still had a few people in my consulting room this morning and had conversations. And there are questions and all that we're asking that are being asked me and all of, and I knew that. See, I was not just talking to the lady, I was not talking to the woman or the man. I was actually talking to someone who had gone to do their research. And what's made it very easy is artificial intelligence. And it was a beautiful conversation because I realized that it helps when you have a well-informed patient and then a properly knowledgeable doctor, then the synergy of coming to an agreement or the ease with which you come to an agreement of the line of treatment is a lot faster. So AI actually supports better decisions. It helps to AI as much as the doctor would actually look at things more holistically, and I'm going to still bring some differences. For AI helps the doctor to actually think fast. I spoke with a friend that practices in America, and I'm trying to. So, what is the difference? Where are you guys at in terms of healthcare delivery and all that? Now, there are some broader differences when you look at the infrastructures, emergency care, and all. I'm just talking in terms of a doctor to a patient. And then one of the things she talked about. Now, let me say this with technology. And now you have a lot of us must have experienced this. Most of the hospitals now, no, so sorry, that's all. The good hospitals in the maybe urban settings have adopted electronic medical records. And electronic medical records has helped to solve a lot of things, solve a lot of problems. Problems like you don't have to wait and they're looking for your file, some of your records, maybe a test result of 2 years ago, you can't find it anymore, and things like that. Or it also help the doctors to follow up on the management and the care, the nurses, and all. The business owner, for me, for example, I'm able to actually follow up on the comfort of my home. The patients being seen in the hospital, what's the doctor prescribing, and all the likes, the financial aspect of even seeing patients. Technology has done that. Now AI, because AI can give you answer in seconds, you're able to also harness the information that's out there, and then you can bring that together, and the doctor can look at that, and then it helps them to make better decisions when they attend to patients. Now, digital platforms also increase reach. I'm going to look at these things one after the other, so I might not say so much right now. We'll talk about telemedicine. Telemedicine is a thing now. A few years ago, maybe we're trying testing it, but there are quite a number of apps. There's quite a number of platforms out there that actually helps with telemedicine. With telemedicine, I can sit here and consult with a patient in Burundi, a patient in Addis Ababa, a patient in Bauchi. I can consult with them. And it's real life it's just video, just the same way you do it's as simple as doing a video call, either with your WhatsApp, which or whatever platform you use to actually converse. And then there are also platforms that have been designed, infrastructure design, apps that have been designed for this purpose. We have wearables now, especially when you look at chronic cases. Now we have watches now that actually record your pulse. We have watches that record your blood pressure, your oxygen saturation. We have there's one that is there and then working a lot on that, monitoring blood sugar and all. When I was in medical school, I know we talked about measuring because we had our lecturers at the time, our professors talking about the fact that as much as you get a spot measurement of a patient's blood pressure, it doesn't give you as much information as when you look at what their blood pressure was over 24 hours, over 48 hours, over 5 days, over 1 week. And it was kind of cumbersome doing that because we say, oh, sir, ma, we need you to go. Do you have anywhere you can check blood pressure close to your home? We need to go check it one day, two, or we need you to buy the device and then check and record it. Now we have wearables as simple as a smartwatch and other devices that they can wear and put on, and then it gives information on the health data that is recorded over a period of time, which you can is downloaded, uploaded into the cloud, and then you can actually download it from wherever you want, make your analysis. Now, these wearables, digital platforms, helps to generate data. Dr. Minka talked about data while she was talking about improving the quality of healthcare. And I was saying that last week that she helped me. So I might not even do so much, but because we have new people on the call right now, I might just say a few things about that. But data generated from all these all the things we're measuring, every measurables, actually will help integrated care. It improves the collaboration between the patient and the doctor, also in terms of their own care, and also helps with better planning. Now, I must say at this point, technology is not going to replace doctors. I'm not going to go out of business. It's only going to extend our reach. And as we continue, you get to understand this. Now, so we're talking about healthcare, the future of healthcare. Who is the doctor of the future? Now, I like the way this has been described. Besides, say, I'm going to mix this and put it here. The doctor of the future is technologically fluent, empathically grounded, data-driven, and entrepreneurial. Now, I'll just break this down. Now, the doctor of the future can't be a doctor that does not understand artificial intelligence or have not used as simple as ChatGPT. The doctor of the future must understand how to use this technology to actually amplify his efforts. Now, the reason why I'm relaxed, I know I won't be out of job, is the fact that as much as AI, yes, the knowledge is out there, could analyze and then look at all the prompts given and then give you stuff. When it comes to healthcare, the soft skills are very, very important. And one important one is the ability to show empathy. Because either you're a doctor, or a nurse, or a healthcare professional, or you have nothing to do in the healthcare space, you would agree with me that when you connect with your doctor, it's easier for you to follow even the prescription and the instructions. In fact, you start to feel well before you start taking anything because you just connect. And one of the ways you connect is because you can feel the empathy, you can feel the compassion, you can actually feel the kind of care. It's said, we don't care how much you know until we know how much you care. That happens a lot, and it's very true in the healthcare space. So, and then all this I'm describing is the human nature of a doctor. The doctors are humans, they're not robots. And the ability to be grounded in their empathy, ability to show that empathy to the patient actually makes them to remain relevant. Now, I've talked about data. The doctor of the future is data driven. Understand data, and we use data in every area of our life. Doctors on the call, healthcare professionals will know. We do research. We're carrying out one research or the other. We're looking at the effects of one drug on patients, the effects of lifestyle changes on hypertensive, diabetic patients, and that has helped some of the instructions we give now, some of the things, lifestyle modifications we actually talk to our patients. So data is important, and then entrepreneurial, because if we're solving problems, we are not also going to be like robots, like let's show up, treat patients, but we're thinking beyond just the engagements we're having in the consulting room. We're looking at how can we multiply this, how can we amplify this, so that we can reach a lot more people within the shortest possible time and as efficient as possible. I talked about soft skills, empathy, adaptability, digital literacy. The doctors that are adopting AI now, the doctors that are adopting technology actually are the doctors who are adaptable, who have the ability to understand what's going on, what's happening at the moment, and then are able to also make shifts in their mindset, shifts in the things that they know, go after knowledge, and then see how they can adapt it to what they do. And then digital literacy. Now, the doctor of the future is going to wear two stethoscopes. One is around the neck and the other in the cloud, because he's going to be pulling data from the cloud, analyze data, and then it starts to apply to make informed decisions. Healthcare professionals that we talk about that a lot. Talk about making informed decisions. That means that you're not just deciding based on what you think. You look at decisions based on the data from the patient, data from patients, from also research that has been done, and then able to actually come to a conclusion on what to do and how to solve a lot of the healthcare problems. AI thinks fast, that is true, but the doctor thinks deep. I believe doctors have a better holistic view of the healthcare and what needs to be done. And I know healthcare is not just actually treating, and that's one of the things the Doctor of Future focuses on, is also on preventive care. And you can do that when you know what the data is, what the data is telling you, when you know that times and seasons of the year, there are certain diseases that you see in certain region of the continent, there are certain diseases that are prevalent. And then this is what has been done to probably look at preventing it, either in ways of vaccines, immunization, in terms of taking care of the environment and the like. Everybody here know understand that when it comes to malaria, we've been taught right from school, primary, secondary, you don't leave stagnant water around. That came from data, analyze data, and then understanding that stagnant water actually breeds a lot of the malaria, the mosquito. So doctors, actually, Doctor of Future, we collaborate with AI for better outcomes. AI will not replace doctors, but doctors who use AI will replace those who don't. Now, so I said a bit about telemedicine. And then, as much as I know, a good number of us have an idea what this is, and it's just tele and medicine. So using the power of video conferencing to actually reach as many people in remote settings. Not just that, even people who think about it. If for every time you need to see a doctor, you don't have to leave your house. The same way we have working from home. Think about seeing doctors from home. Especially, you know, there's some follow-up visits that are sometimes because I have patients coming and then patients coming, wait a bit to see me, and then in 2 minutes or 3 minutes we're done. Sometimes I can't see I have to give value to these patients. Sometimes I think of what else can I just see, just to, just to reward this patient for coming all the way and all. Such consultations, I'm sure they would gladly love to have it. A few months ago, I think we had this couple that were coming from Ogun State. I stay in Lagos State to see me and all. And then at some point, we have to come to an agreement that, okay, for some of your follow-up visits, we can actually organize a telemedicine consult and cost. They were so excited and all of that, and that was something that was good. So telemedicine would help to transform and then solve the problem of people in remote settings where they don't have adequate healthcare infrastructure. Sorry. Now that means that a doctor can actually cater to 3, 4, 5,000 or more patients if he does not have to move from his own location to where they currently are, because of transportation, the risk involved, the traffic and all of that. So telemedicine adopting this actually first will help us close the gap of the inadequate healthcare personnel that we have. In cases, like I said, follow-up or continuity care through virtual calls, virtual care. So you have people who should actually be followed up. But sometimes we lose them to follow up because of, look at someone who traveled or worked, rather maybe had to take permission from work to come see you. And then after 2, 3 minutes, because you just check this, look at their measurables, and then consider, okay, these are drugs, this is fine, and all of that. And then you move on. After a while, the patient probably say, I don't even need to come. Or you have people who are in remote settings that have to travel as much as 24 hours before a see doctor. Telemedicine is a game changer. We already have that happening. But I'm talking about the fact that we have a wider adoption of that. Now, and then, of course, it's lower cost of care. Because first is they don't have to spend all the money to transport themselves. Secondly is that they can also, of course, that also is cheaper to them all around. And what's the impact of this? It extends healthcare reach to underserved areas, like I just mentioned, and then improves patient outcomes through timely care. Because then they can see doctors on time. they get the right instructions, prescriptions, they adopt that, follow up, they're not lost to follow up, and then that helps to bridge that gap. Now, we already have some real life applications in Africa. So we're talking about the future. We're talking about some of the things we're already seeing now. But we see that what I'm trying to say is some of the things we're seeing now already it would shape where we're going to. So just go along with me and then let's continue to imagine this. Now, we have some guys in Ibadan and then they develop my bell. Now, my bell actually, basically, most of these apps will get towards the maternal and child health because the maternal mortality, infant mortality indices in Nigeria, in African countries, is really, really bad. And this is how a few guys that came together and say, how can we solve this problem? Now, you know that knowledge is one of the ways you can influence change in people. Most people will act based on what they know and what they believe to be true or the right thing to do. And that's most of these apps like My Bell or Mommy Mobile Health also have done a bit of that. Is look at educational content on pregnancy, childbirth, postpartum care, so that they begin to understand what's going on, what the changes in their body actually mean, what to do at the right time, and all that. That's one. Number two, these apps help them to track developmental milestones, track their health. They know when certain indices are deviating from normal. And then they also offer platforms for mobile care. Now, mobile health, I know, also does telemedicine, and they also, I think they not that they have these mobile clinics. You see, they also try to reach as many people as possible. Rwanda is where Zipline is used. We have drones that are used to deliver essential medicines and blood supplies to rural health facilities. So these are things that are going on already. WHO has been trying and they've been talking a lot about universal health coverage. Rwanda is a very good example of a country that's achieving universal health coverage as much as possible. Now they have this. Now it's similar to some what you have in some other countries, but the adoption is really great in Rwanda. And then contribution, nothing is free. You say healthcare insurance, some people are paying for it. And then the way they've done that is been stratified. The lower um, your financial situation is, the smaller what you pay. So you have guys who are in the low income areas pay a little amount of government majorly pay. The middle income earners pay a bit more than the low income earners, while the high income earners pay a lot more than the others. And this is something government has backed, and that's something that's important. We are not doing so much if we don't have the political will, the government's will, the government backing and all. And then that's what they've done there. And then you find out that say they have like community managed healthcare infrastructure. They use a lot of not just doctors, community health extension workers are trained actually, and they actually are in most of the remote and rural areas. And then with the help also technology, leveraging on technology, ensure that healthcare gets to people as much as possible. They emphasize on primary care. You understand? Then most of their healthcare has been decentralized. And then they offer there are some rewards, performance-based financing rewards to healthcare facilities for quality and quantity of services. And like I said, the adoption is good. The strong community engagement, the health workers and the local communities, like public health, the teachers, you actually ensure that the community takes ownership of some of these schemes, and that's what they have there. And one of the key outcomes is the fact that there'll be significant reduction in maternal and child mortality rates. Now, this is just an infographic of what I talked about. So, community-based health insurance, government subsidizes their comprehensive benefit, and then the focus is on primary care. Rwanda has done this, and they are still doing it. Rwanda is a country in Africa, mind you, not a Western country. And I believe that other countries could do this because if one, we leverage on technology, AI, we're able to achieve universal health coverage in the countries in Africa, then we will be talking about the future of health that I personally am envisioning. Now, I talked a bit about data. Now, data is the new currency. Data is also the new health currency. Dr. Minkas talked a lot about. She did a beautiful job last week, and then it helps us because with the right information, you can make the right decision. Better decisions will require quality data. Now, data is nothing if it's not collected. It's not collected the right way, and that's why you see the image on the left side of the screen. If it's not collected the right way, proper data integration, analysis. We've seen all the data in front of us, analyzing it. What is it telling us? And then, of course, it helps to support making decisions, and this helps resource allocation. There's no point pushing a lot of resources to areas where you don't have those issues or those diseases. So, and then, of course, improves your positive health outcomes. So you can see there are two diagrams here. There's one right in the middle that talks about where we are currently, Africa, but where we can get to with the head of the things we're talking about is what you have in the outer layer. When you have collect your data properly, because even almost every hospital care infrastructure data is not properly collected. Electronic medical records help us first to actually collect data. Then, of course, integrate depending on the level of the EMR you have, and then you can make your analysis, make your decisions. I run two hospitals in Lagos, and one of the things that help me make decisions is the kind of information I have access to. The electronic medical records help me with that, and then I also collect in other ways. But technology is a very good way to do that. So building African health data systems that are secure, interoperable, and locally maintained infrastructure would help. And data improves planning and forecasting, predicting disease outbreaks, medication needs, and staffing requirements. If you actually have the right data analyzed, and of course, you actually can predict where the next disease outbreak is, so with a very minimal margin of error, degree of error. And then, of course, this helps reduce waste and improve outcomes, even as simple as in the hospital. If you don't have the right data for example, what antibiotics, what anti-malaria, what drugs are actually consumed or are prescribed a lot more than the others. You probably will have a lot of your inventory of your money tied in inventory of drugs, consumables you purchase, and then they're just sitting down on the shelf. So what are the challenges of data integration? Because we're saying it's important. What are the current challenges and how do we then get to solve it? Infrastructure and connectivity constraints. As much as we were talking about technology and all of that, the internet is something that's very integral to this. I talked about the stethoscope of the doctor not just being around his neck, but it's also in his cloud. The way it can actually pull information from the cloud is also through the internet. So the connectivity constraint, the infrastructure, internet is not really that stable everywhere in Africa. I've had to recruit doctors and nurses from remote parts of the country, and then when we try to have virtual interviews, sometimes getting through the 30 minutes, 45 minutes of interview sometimes is a lot of problems because of the connectivity. Data security and privacy concern. Now, a lot has also been done here in terms of ensuring security of data, because we know that confidentiality is a major thing, especially when it comes to healthcare. We don't want to hear your server or the cloud is being hacked or information and leaks like we had, I think, in the Western world for a few years ago. And then, of course, we have to standardize it, because how I get data, how I receive data, and then keep it actually should be standard, so that when you actually pull out some of the inferences, some of the analyzed data and the decisions made, should be able to actually apply to you other settings, other countries. They're having to start making a lot of adjustments. Yeah, so leadership in the digital age. Now, clinicians must evolve into digital leaders. Now, it's very important, and I'm trying to speak to my colleagues on this call, that it's important that actually we understand technology and its applications. The digital literacy should be, in fact, it is mandatory as far as I'm concerned. You need to understand how to actually use these devices, how to collect data from them, how to analyze them, how to, as simple as even some of the AI platforms we already have, How can I use it to make my work better? It's not a function of, because when I was practicing, and when practicing medicine started, there were questions like, you don't want to, while seeing patients, you don't want a situation whereby you are checking books, and then as the patient will say, this doctor does not know anything and all of that. One of the things you find that even early in life is that even when I have friends who traveled out and they are practicing in the Western world, always we told us that, see, or like here, in fact, some of the patient wants you to check and be sure of what you're doing. You understand? So you actually should be able to leverage on what AI can do and how it can help you even in managing your patients. Now, leadership, not just leaders, empathy, and back here, talking about empathy is very, very essential. Now, note this, I'm saying it again, technology supports, not replaces the doctor. The doctor who has the ability to actually utilize it to amplify his own effort is actually the doctor of the future, the doctor who is relevant in the future of healthcare in Africa that we're talking about. Best leaders are those who empower and those who empower others with technology, not those who simplify the use itself. Just basically still talk along the lines of leaders also influencing the next generation, influencing people that actually work with them, work under them to actually make the right changes and of course apply the right tools. Now, what's the role of the doctor of the future in practice? I'm just still saying, like I said, I'm using doctor as the indices in trying to say this is the kind of healthcare personnel we actually would need in the future I'm talking about. Now, some of this might actually be slight repetition, but I just like to bring them out for emphasis. Clinical digital intelligence. That's the ability to blend traditional medical expertise with digital literacy and data analytics capability. The doctor is the one who has been infused. The more I talk about this, the more I look at this, I actually always think about Terminator. I don't know if you remember Terminator, Arnold Schwarzenegger, and we have the human one and then the robot. It's like he has the robots underneath the human skin and all. So it's the doctor who is really merged his own humanity and also with the digital intelligence, compassionate care. Now, I don't know how many people knew this. I think it was last year. Yeah, last year, I decided to do the free surgery for 40 people. We had a lot of people who turn out and all of that. And I know that over the course of the year, we did about 100 or over 100 free surgeries. Now, that came from someone who had compassion and the heart to actually help solve the problem. And that's some of the things we're talking about. So beyond, and when I say using technology to amplify, it's what you have within you that you're actually amplifying. That's what empathy, compassion is very, very important. Because as many people have solved some of the problems you already have, it's not just because they're trying to chase the bag or trying to make money. It's because they are shown concern and then the problems that are on ground and say, how do we solve it? As much as possible, I'm sure even as healthcare personnel, you have situations where we have relatives who are in other parts of the country, other parts of the continent, and then um, they require care. And then you wish and you pray that they have someone who would show as much level of compassion you would, because members of the family or how you actually attend to your patient as you towards them. You understand? And the simple message really is, as much as you cannot be there for every member of the family or friends and all, the question is for those around you, how much care are you actually giving? How much? And then if you actually care that much, that you also want to figure out how can I help as many people as possible? How can I make sure that it's efficient, it's seamless, and it's fast? Compassion is important. Um, and the course of this year, I've gotten messages, I've gotten phone calls from people who were blessed with what we did last year. And then they're like every year that's my birthday, the remembrance and all. And that's very touching. And that's just one person. But when we have a good number of people, whether being a doctor or not, coming together and like, see, this is a major problem and let's solve it. How do we connect with this? How do we connect with those that are already doing such? How do we connect by without using resources, knowledge, and all that? What I'm talking about, you realize that if you're either you're in the tech space, you're in the healthcare space, you actually sit down on a lot of resources that can be used. Everybody can actually come together because the roadmap is here. The way to get there is clear. It's just to have collaboration, have a lot of people come together. Then we also have talked about his tech amplified, the impacts, of course, amplified with technology, and then someone who is a connector and a leader, which is important. That's one of the things I'm talking about. I'll speak a little more about that. There has to be a lot of collaboration. You understand? So I have someone who can educate, communities, connect with them, healthcare ecosystem, also even the government and all, bring everybody together to sit down and then have, oh, this is what we have to do, and see how everybody can identify their role in delivering this. Yes, when you look at, and one of the reasons why I said, see, like technology alone cannot solve all of this. Technology is not enough. Patients still need empathy and trust. I talked about the fact, the role of connection, compassion, connecting with your doctor, the part of understanding how much they care in actually achieving quality care. Human connection is healing. Technology can only amplify the compassion, it cannot replace it. So I come back to those three words: empathy, trust. Trust is foundation of effective care and connection. The moment a connection is achieved between a healthcare provider and the patient, I believe that's where true healing becomes. So humanity has spoke a little bit about what it did, and there are quite a number of people that have done this. I even had someone who joined who like, oh, I'm also doing this. I want to be a part of it. I want to be silent, but I want to be, and then they've done that. So humanity is really important. So as much as I've talked about adopting artificial intelligence, amplifying our care through technology, we must not miss out the humanity part. Now, I said it, and I've used this word leapfrogging a few times, that with what we have and what I'm talking about, we are not going to try to improve because there's not much to improve on the system we already have. We have to create new systems, new solutions to actually solve the problem. So building new healthcare systems is very important, not just upgrading what we currently have. You understand? Creating, and I'm opening and inspiring a lot of minds to actually create healthcare solutions from ground up to solve because our problems are unique. But one of the major problems that I identified early on in my presentation is the wide gap between the population and the healthcare personnel. How do we bridge that gap? I talked about telemedicine helping. I talked about some mobile apps actually helping, bridging that gap. You understand? And then there's still a lot more we can actually bring to the fore about that. Mobile first for population, a good number of Africans, as I have here, over 80% have mobile phones. And that's how M-Pesa actually started. That's what a few of the other platforms I talked about, mobile health, and all, and Bell, what they have actually leveraged on. The fact that we already have phones. What can we do that we can put on phones and ensure we are able to bridge this gap? And what it does, it helps to improve access. And access is very important. That's the other problem. Access. The disparity shows actually gives a problem with access. That's one. The fact that we have an unequal distribution, urban-rural distribution of solid healthcare infrastructures, doctors, nurses, laboratory personnel, scientists, pharmacists, and all, also widens this gap. Mobile first population. We have a population with a lot of people with mobile phones and a good number with smart phones. We can actually leverage this. And the last one, I talk about youth population, our young tech savvy workforce. 60% of African population is under 25. And that's create a generation of digital natives ready to innovate. There are people who are under 25 who cannot understand that there was a world without the internet. Now, I'm actually a millennial, and we're kind of in between. We didn't grow up with internet, but at some point, we caught up with the internet and all of that. And now, one thing you should know that the adoption of the guys who grew up, who were born into And as soon as they understood their right from the left, they already had internet. The ability to actually make use of it to create a lot of things, the chances are higher with them than those of us that we had to learn and then we're getting used to it and the like. That's why a good number of people that have nephews, nieces, children that even less than 5, they pick up your phones and they can do stuff. That's what they grew up understand. They grew up with that, and then they know. And then, so we have a lot of our population under 25, and then we also put leverage on this to create these solutions we're talking about. So we have quite a number, a few success stories in African health tech, and I talked about a few of them. We have them in Nigeria, Kenya, Rwanda. I talked about, and then of course South Africa too. The good number of those success stories that here, and then I highlighted. You can read that once you get to the presentation and all that. So the reason why I put this slide here is to say that hey, it's not all doom and gloom. We actually have some success stories, and they already started already. So all we're doing, all I'm trying to encourage a lot of us to up on the train and then also help to accelerate our journey towards this future. There are challenges we must address. Digital infrastructure gaps. I talked about using the internet as an example. We talked about most of the devices. I talked about telemedicine and all. There are devices needed for this. We talked about, so that's a gap that must be addressed. Now, as much as, and most of some of these things, of course, have to come, like I said, the political will, government coming in to our aid to actually ensure that the right things are put in place. Power connectivity issues, that's still a major problem. But like I was discussing with Ibrahim before we started, that power is something that, yes, there was a period that was like, see, power is a problem. Right now, for this presentation, I had to disconnect myself from the grid, and then I'm actually on my inverter right now, such that light, either there's light or no light, I'm fine for the duration of this presentation. That's still a major thing. Not everybody can actually afford that. And then by affording, but even if you have to put that in your hospital and all, it drives up the cost. Sometimes when the overhead is really high, so you have to find a way to actually sort that also. Then there are a bit of funding limitations. We've had periods where we had a boom of funding for most things, tech, health, and all of that. But I think we're seeing where a lot of people are really coy about actually funding one thing on there. But that's something that's a limitation right now because technology is expensive right now. And then, of course, things are better than a few years ago. And I know that with advancements in those areas, you can actually make them more affordable. And then, of course, trust. When AI has been around for a few years, but a lot of people have been skeptical. A lot of people have been like, oh, I'm not sure. But I think we can trust it. I think we can actually look at improving the adoption. It's very important. We need to improve and increase the adoption of universal health coverage and also technology, artificial intelligence in helping us to actually scale health care. Yeah, what are we doing next? Like I said, so it's like we're solving the problems. We have to invest in digital infrastructure. We actually have to expand, reliable connectivity. We have to look at power solutions, computing resources, so that and that to support healthcare across urban and rural areas. Build capacity for healthcare workers. Now, I think as many people as possible have to start getting into learning actually how to use these AI tools. There are a lot of AI tools. There are a lot more than ChatGPT and Gemini, and you can do a lot with them. You understand? Interestingly, 80% of this presentation was actually not the content, but the slides actually prepared by an AI platform. You understand? I just put it, went to bed, woke up the next day, I already had. I didn't have to tweak a few things to actually suit what I wanted. With the right prompt, you can actually get things done. Strengthen regulations and governance, and that's what because our governance policies actually it's important that they also actually help us with. Sorry, just a minute. So our policies and all of that of government actually should help and support adoption of technology and using that in solving our problems, healthcare inclusive. So we expect that the frameworks like data privacy and some things I talked about are actually back. Then promote public-private partnerships. And some of the things I've been preaching all year is that sometimes you can't actually wait for government to solve all the problems. I think a lot of private individuals, private organizations also have to take the bull by the horn and start to solve the problems within their vicinity. I feel that if as many people as possible solve as much of the problems in their vicinity, and then different people will form silos of solutions that at some point they coalesce together and then actually they deliver the solutions you're looking for. It's not as easy as I said, but so we start to try, we start to think, we start to plan and innovate, and then in solving those problems. And then I think at some point, government would actually pay attention and see how they can also help because it looks like you're doing their work. But at the same time, you're the one, it's just like you get into a house, even if it's rented, and then you're like, oh, the door is bad. I don't want to fix it because it's not my house and all that. And landlord is not fixing it. Leave it. And then, of course, you're the one who, the door will not secure anything. You're the one who suffers for the 1, 2, 3, 4, 5, 6, or 7 years. You have to live there. So we wear the shoes. We know where it pinches. We can start solving the problems at our level. And then we can look at how we can have collaborations with the public sector, partnerships, and the like. We've seen how that's worked out and it's still working out, for example, in the petroleum sector in Nigeria, and how government and then the private sector are trying to see how to make things better. That can be extended to health care. Yeah, so let's just reimagine what I've been talking about, the health systems. I want two things are what? Collaboration and equity. That partnership between government, private sector, NGOs. I talked about that. And then, of course, technology married with policy. And so policies actually look at how policy around technology. Because sometimes people are afraid of what they don't understand. So sometimes they actually run away from it or try to create policies that stifles it rather than understanding. Of course, rather, I was actually having conversations about around the financial institution and crypto and blockchain and all of that. And one of the major conversation around regulation is that we need to actually understand this thing before we even start saying we're regulated, because we need to understand what we're regulating. But there's also a responsibility of those who are actually promoting this technology to also ensure that they are also like people under authority and then they are being regulated the right way. Now, technology is supposed to help to solve the problem of unequal distribution between the urban and the rural setting. We must make sure that these innovations I'm talking about do not widen this inequality, because you know that the infrastructures are more readily available in the urban setting as opposed to the rural setting. So that is very important in the future we're imagining. And doctors leading with empathy. And Africa, where access is no longer a privilege, is what I'm preaching to you today. So, what's my vision 2035? A healthier, connected Africa. And a roadmap, simple as, and you can see this roadmap listed all across my presentation this evening. Universal access to quality healthcare, digital systems powering prevention. Like I said, it's not just treating. Also look at how this information helps us to power prevention, because prevention, they say, is better than cure. And then empowered healthcare community. So doctors, nurses, and citizens are equipped with the tools and the knowledge to co-create positive healthcare outcomes. This is like a manifesto for 2025. It's not like I'm running for the Minister of Health or President, but this is what I say. And Peter Drucker says the best way to predict the future is to create it. So what's my final charge to everybody on this corner? As many people are going to watch this. Today, we can harness technology's power while maintaining our humanity to shape a healthier Africa for generations to come. The future of African healthcare lies in our hands. Technology gives us speed, humanity gives us purpose, and action creates our future. The best way to predict the future is to create it. Thank you very much.